Does a patient who is terminally ill have a right to refuse medical treatment? Do loved ones or close relatives or guardians have a right to decide to take an individual off life support when in a vegetative state, knowing fully well that the inevitable is only a matter of time? Does the right to life and liberty enshrined in Article 21 of the Indian Constitution also include the right to decide to die with dignity? These were some extremely challenging and morally compelling questions confronting the Supreme Court. On March 9, these questions were answered in the affirmative by a constitution bench of the Supreme Court, which upheld the right to die with dignity as a fundamental right and declared passive euthanasia and a living will to be legally permissible. Its assent to passive euthanasia marked a reiteration of its position in 2011. Passive euthanasia, simply put, is the withholding of medical treatment to a patient to allow the course of natural death to conclude. In the context of this judgment, this pertains to patients in whose cases the process of natural death has already commenced. This principle was first upheld in the Aruna Shanbag judgment of 2011. Aruna Shanbag was a nurse at Zen Hospital in Mumbai who was reduced to a vegetative state after being raped and brutalized by a ward boy, Sohanlal Valmiki, in 1973.
If you look at medicine today, there is evidence-based medicine which we follow in science, and there is also economy-based medicine. We have so many extremely poor patients who are in vegetative conditions, who have almost zilch chance of improvement, who will sell or mortgage their farms, their lands, their houses to sustain a patient who is never going to recover. So one is the moral issue, the legal issue, and the economic issue. We see this very often. Patients who have terminal cancers, where the cancer spread to all organs, who are on life support, and medical science is such that life support can go on almost endlessly. You can have dialysis, you can have ventilator, you can have pacemakers, you can have all kinds of supports, and this could go on for weeks to months, where not only the family is traumatized emotionally, but at the end of that, not only they lose their loved person, but they are financially bankrupt. So this is something, it's always going to be a gray area. No Supreme Court can cut into the jurisdiction of a archbishop or Islamic body or a mahant. But this is something that I'm glad the Supreme Court has taken the initiative and laid down these clear guidelines for medical professionals to follow. If you look at this couple is both in their late 60s and 70s. They do not suffer from an active illness. They just feel that the quality of life is terrible and they don't want to continue life. Now that is a very dangerous area to be in. This bill is essentially aimed at patients who have a irreversible illness where there is no recovery. It does not mean active euthanasia. Passive is an error of omission, as in we will not connect a ventilator, we will not put a patient on dialysis, we will not put inotrope. Error of omission is illegal in most countries of the world where a doctor assists death, where you are actually giving an agent to cut short life, and that is playing God, and that has got enormous dangers and loopholes. I think it's best we steer clear of that. I think the Supreme Court has done a great job. I think the famous case of Aruna Shanbag, the nurse who was raped in Zen Hospital, who is vegetative for more than 20 years. I mean, what kind of life have you given her? And it is horrible putting yourself in that patient's shoes, being 20 years, vegetative state, bed sores, lying in a bed, cared by unknown attendants. Her own family had abandoned her because of economic issues. So what kind of quality of life have you given this poor lady? A nurse in KM, and she's been looked after by the same institution that he served. So this kind of judgment is going to do wonders for such patients.